Hey guys, it's Dania and welcome back to my channel. So this is part 3 of my plastic surgery and placement video series. Today I'm going to be talking about what I learned from my first ever plastic surgery placement, how I self-organized it. I was able to sit in 4 to 5 hours of consultations in the morning, went and saw a basal cell carcinoma excision, my first ever surgery and OT experience, and then was able to have a dinner seat reserved for me in a prestigious plastic surgery event. Before I begin, if you've enjoyed this series, make sure to hit that thumbs up button, subscribe, and let's just jump straight into the video. So I went on LinkedIn and directly contacted a bunch of different plastic surgeons that live within a 2-hour radius of where I am, and basically said that, hi, I'm a second year medical student aspiring to be a reconstructive surgeon, and if I could shadow your work, please let me know. One doctor, Dr. Scott Ingram, got back to me and was like, yep, come, you can shadow my work, that's fine. I was so unsure of how a day-to-day basis would be for a plastic surgeon, and this experience had showed me exactly that. I was able to see Dr. Scott from an 8 a.m. to a complete 10 p.m. day, and it was so insightful. I think I was also really privileged that he was so passionate about education and teaching. For example, every patient that came in, he was like, come, 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 and he'd put the light on where their BCC or SCC was and show me exactly what it looked like. For example, he'd be like, oh, from afar, a BCC looks pink, but when you go closer, it'll have a white dot in the middle. He was able to teach me so much across the day, and it was so interactive and such incredible kinesthetic learning that I have absorbed it directly into my brain. For example, he taught me that a ruptured ganglion was due to hyaluronic acid, and that's the same thing that we use for lip fillers and cosmetic fillers, which is incredible. So I will never forget that fact, and you probably won't either. To teaching me about the pathophysiology of lipodermatosclerosis, because he's certified as a general surgeon as well. He just made sure that I knew the pathophysiology, the etiology, and the symptoms and presentations of everything and every diagnosis that came in. And it was so incredible because even though I'm in my 3rd semester of medicine in my entire degree, cases that I've learned about in the past 6 weeks were shown in that placement. For example, osteoarthritis, and he was able to ask me what the nodes were on the tip of the fingers, and there were Heberdin's nodes, and I was able to point out on the x-ray that the osteophytes, that's what it was due to. And somebody came in with carpal tunnel syndrome, and I literally learnt that 4 days before the placement. I had their entire case on it, I had the entire pathophys. For a week I was learning about that and the upper arm muscles and everything. So it was just so incredible that in my 3rd semester of medicine, I knew that I would be using this knowledge 50 years down the line. So that's the consulting side of things. I loved it. He was so passionate and so in touch and down to earth with his patients. Every patient that would walk in, he'd open the door for them, he'd shake their hand, he'd like pull out the chair for them. He was just such a gentleman and respectful throughout the entire day, and I could just see his passion flourishing, and it was just so contagious, the positive energy he had in his practice. Now, moving on to the OT and the BCC excision, you can see all this surgery and all these plastic surgery videos on YouTube. You can see them excising it out, you can see the scalpel cutting through the skin, the subcutaneous tissue, everything. But when you actually see it in real life, it's insane, because the BCC was on the face, so it was on the cheek, so there was a rhomboid flap that needed to be done. So actually seeing somebody cut into somebody's face, open it up, cut a square chunk out, send it to the pathology lab, and then stitch and suture it back up. I literally can't express it in words. It's such a surreal experience, and as weird as it sounds, I completely fell in love with the idea of that. Not like in a creepy way, but in a medically related field, the idea of surgery is incredible. I was able to stand right next to him in my little scrubs in the OT, and he was performing the surgery and simultaneously teaching me and another nursing student about everything he was doing, about the 60-120 angles in the rhomboid flap. Because this excision was done on the cheek area, he purposely avoided the temporal branch of the facial nerve because that supplies the muscle up here and that's responsible for raising the eyebrows. So he purposely avoided that to not sever that nerve. It's just, he was teaching me and I was literally like a vacuum, just sucking all that knowledge in because it's such an interactive and immersive environment. I finished at around 3 p.m. because I had to rush off to another appointment, but he had around a few more cases to do in the OT, which I wish I could have saw, but I was like insanely mesmerized by that one alone. Overall, I learned so much stuff and I've told you guys a bit about it, but the thing that I really liked is I learned so much about plastic surgery in the field as well, because I'd see him explain to his patients the type of surgery he was going to do and even little intricate procedures that are so specific, such as the abscess lander flap for a lip reconstruction. It's crazy when you can sit in a room and be with somebody that you can envision to be in 20 years. That's such a beautiful feeling and it's so empowering to be in the presence of somebody like that who's willing to help and share their knowledge. Now the last thing was that Dr. Scott was able to reserve a seat for me in a prestigious dinner with a bunch of different plastic surgeons, and it was basically representatives of an implant company coming in and talking about their implants to the plastic surgeons who are using them and just showing the statistics. It was an incredible networking opportunity and getting to know the face of the plastic surgeons behind their job or behind them being my seniors, because Dr. Scott would introduce me to people who would come near our table and he'd be like, oh, this is the medical student that's here observing today. Next Friday, I'm going to be going to my second placement, so hopefully I can vlog a bit more. Dr. Scott said that I can vlog as much as I like, which I'm really excited about. Obviously, I want to be able to do it in the consulting rooms or in the OT or anything because of confidentiality, but I'm just so happy and I'm sure you guys can tell. But yeah, I'm just really happy. Anyways, I am done for this video. Make sure to like or leave a comment if you guys enjoy following my medical journey. Other than that, have a good one and I will see you guys in my next video.